What's up, guys? It's Dr. Luke here with
Dr. David.
Dr. David. We are in our new digs.
Yeah, we're loving it. About a
Oak
month in.
Terrace Clinic, and yeah, it's pretty sweet. If you didn't notice, orange is our color, and we have this sweet background. We're gonna just like give you a little. Check it out. Check it out. We got sweet little space here, but we're not here to show you around the clinic. We're here for our
Curiosity Corner.
Curiosity Corner. Yeah. But first, we're just talking pre-show about what was our favorite thing you had to drink over the weekend?
Well, with New Year's and everything like that and the holidays, I dabbled in a little eggnog. Some people like it, some people hate it. 1 or 2 glasses. I enjoyed it.
Love eggnog.
Do you?
Yeah.
Some people don't.
I had eggnog over the holidays with peanut butter whiskey.
Oh.
Recommended from a patient. But
I did a little rum shot.
Oh, it's solid.
Yeah.
That's double cream, actually.
Yeah. Stomach was hurting a little bit, but worth it.
Well, I was thinking I would tell you my favorite drink, but first I would just let you know that, well, for all of you guys out there, we both have young kids.
Yeah.
You know that young kids love to do really smart things.
Mm-hmm. Yeah.
They're always very careful.
Very convenient. Yeah. Timely. Whenever you feel like you have a bunch of time. Yeah.
Well, I was at the tire shop getting my tires changed, and they were bringing my car around, and my 4-year-old son decided to stand up on the waiting room chair, try to slap me in the butt, and fell off and hit his head on the coffee table, split the back of his head open, blood running everywhere, and I went to the bathroom, got paper towels, got him cleaned up, and came back out, and the discount tire guy, your car's ready.
Blood in your hand.
So, yeah, we got that taken care of with some staples. Another traumatic experience. So you heard that. It was a mess, but fun with kids, right?
Never.
They're curious,
yeah.
And we're holding our curiosity corner because our patients come to us with questions all the time. Obviously, they're coming to us to have them solve problems, and we like to talk about different issues that our patients are having, common things.
Yeah, one thing that we're seeing a lot more of, especially in the gym setting that we're in, is kind of like grip-related injuries or overuse injuries at different spots, whether it's hand, wrist, elbow, or shoulder. We're going to talk today a little bit about very common aspects of irritation to spots on the elbow, right? So with repetitive lifting, with strength training, a lot of involvement has to come with our pivot points, right? So areas that kind of have vulnerability. And I know both Luke and I see it a lot in the clinic, but we want to kind of improve everyone's knowledge about why people may get tennis elbow or golfer's elbow, or you might even hear it called lateral epicondylitis. That's what we're going to kind of delve a little bit deeper into.
Yeah, very frequently, like David was saying, in our lifting heavy population or CrossFit, powerlifting, Olympic lifting, but in the handle sports as well, paddle sports, we see a large requirement with the forearm muscles. And the thing about gripping in the forearm, once you squeeze or grip, you can't isolate one side of your muscle groups. If your flexors and extensors at the elbow, there's no way to just say I'm gonna work on the flexors of my forearm or the extensors of my forearm. It's a lever system. It's a push and pull, and so we frequently see irritation. A main complaint might be on the inside of the elbow here, but they also have some symptoms on the other side as well. And we need to look at both sides, not only at the elbow, but we should be looking at what's going on with the shoulder, the neck, the cervical spine. There's nerves. Some very sensitive nerves that run through that area that are superficial, that can become irritated and tight with the muscles. But the other thing we need to be asking, and you should have people be asking you if you are the patient, is we're talking about frequency and load. How often are you performing grip? Did you increase the amount you're working on your pull-ups, or did you decide to play 8 hours of tennis?
It is a new year, right? So we're gonna see a lot of these injuries happen, right?
Exactly.
People that may not have exposed themselves to high level training or to just getting back into the gym in January, and they go all out and it's
balls to the wall.
Yes, indeed. Yeah. So 3 weeks in, people may be complaining of these injuries, and that's why we want to kind of talk about how do we prevent them? What can we do to kind of keep those habits going, our New Year's resolutions? We don't want to be limited by irritation. It's going to happen, but we want to kind of talk about what we can do about it.
Yeah, absolutely. Physical therapy is a stop for people to address those situations. And, it comes first with a good evaluation to make sure it's coming. If someone's coming in with medial elbow pain, we talked about the different aspects that cross the elbow there, nerves, muscles, tendons, ligaments, kind of try to find the underlying cause of the issue, but then talk about the different variables of why that happened. Such as Dave was saying, people going really hard, too much volume, too fast during the new year here. And once you have someone that can tease that out, like David and myself, then we can get into the treatment aspect, which we're going to have a video on that as well here about how we might initiate treatment in someone that's coming to see us with elbow pain that's pretty acute or even chronic in nature. Most people won't get this addressed right away because it's not limiting their everyday thing. Everyday situation. It's not really limiting them as much as something like a rotator cuff tear or acute back injury. So most people deal with the elbow pain for a couple months before they'll even try to get it addressed.
Yeah, we see it all the time where, I might be evaluating someone's shoulder and they're like, oh yeah, I've had this nagging elbow injury for the past 6 months. Can you help me? And we always want to have the earlier we see someone, the better. And it's typically, well, I got to the point that I can't lift anything anymore. You can't lift that coffee mug or can't kind of open the door to your car. We want to see you a little bit before that. But Luke's going to kind of go over what would happen if you come see us for physical therapy, how we treat it.
Yeah, so guess what? You're going to have to check out the next video for that. We really appreciate you guys checking in these videos. And check out this next video for our intervention techniques for elbow pain.
See you next time on Curiosity Corner.